Welcome. Welcome to the, I think this is the third Health Data Exploration webinar. My name is Cinnamon Bloss. I'm an investigator in the Health Data Exploration Project and a faculty member here at UC San Diego. The HDE is a Robert Wood Johnson funded project based here at the California Institute for Telecommunications and Information Technology here at UCSD. It's led by Dr. Kevin Patrick, together with a multidisciplinary group of investigators as well as industry leaders in data science, medicine, engineering, ethics, many other areas. And we would really like to thank you all for joining us this morning. As many of you know, the goal of the HDE is to explore barriers and facilitators to the use of personal health data in public health research, and also to explore kind of hot topic issues in that general area. We define personal health data very broadly to include data from wearable sensors, smartphone apps, digital trace data, personal genome data even, and microbiome data. And so, we hope will be an important project in this space. Importantly, a major part of what we're also doing in the HDE is we're trying to build a network of individuals, of stakeholders who are interested in these issues. We currently have over 60 individual and company members in our network, but we're definitely looking to expand. So I would like to encourage you all to go to our website and sign up. There's lots of perks, the opportunity to network with other individuals who have interests in this space, as well as possible future pilot grant opportunities and other sorts of things. So this morning we have, I think, what will be a very interesting topic. The title of this morning's webinar is Personal Health Data, Workplace Wellness Programs, and Privacy Challenges. And so I'm going to, we have three kind of participants in this morning's webinar, but we want for everybody who views the webinar to be participants. So as the webinar goes forward, I would like to encourage any of you with questions to, you can either tweet your questions or you can submit them through the Google Hangouts. Exactly, and what's the Twitter?
Hashtag HDE webinar.
It's hashtag HDE webinar. And so this morning's speakers, I'm just really delighted to have with us. We have Michelle Demoy, who's the Deputy Director of the Consumer Privacy Project at the Center for Democracy and Technology. We also have Emily Reed, who will also give a brief background, and as well as Debbie Chalfie. And I think with these participants, we're going to have a really interesting discussion this morning. So Michelle, I'll let you take it away.
Okay, and maybe what we can do is I'll just give a little bit of background, very short, on me, and then my fellow panelists can briefly introduce themselves, and then I'll kind of dive in. So as Cinnamon mentioned, I'm the Deputy Director for Consumer Privacy here at CDT, the Center for Democracy and Technology. And my focus is on health data privacy. So in the last year, I've been particularly focused on new technologies like wearables. And the latest thing I've been doing is developing a project on internal research and development that is privacy protective and ethical at wearable companies. And we've been doing this with the company Fitbit. It's been a great project, and that should come out soon. And so I'm really thrilled to be here today with my colleagues from Bazelon and AARP to talk about an incredibly important issue in personal health information privacy. But first I'll pause and let Emily introduce herself, and then Debbie.
Hi, I'm Emily Reed with the Judge David L. Bazelon Center for Mental Health Law. We usually refer to ourselves as the Bazelon Center. And I'm a senior staff attorney. I focus on employment discrimination, litigation, and policy work, but I also do other kinds of system reform work, and I'm delighted to be here.
Hello, everyone. This is Debbie Chalfie with AARP. I'm a senior legislative representative here on our economic security team in the Government Affairs Department, and I work on a variety of employment issues of concern to older workers, including employment discrimination, unemployment, and workforce development. And as you can imagine, recently we've also been doing a lot of work on the issue of wellness programs. So I'm very pleased that you invited me today. Thanks so much.
Sure. Thank you guys really for being here. And in case you don't know, out there in the web world, these are two of the top experts on some of these issues in civil rights. And so it's a great treat that they're here today. So I'm just going to give a little bit of a baseline on what it is we're talking about here. And it can be a tiny bit wonky, so I'll do my best to not use a lot of acronyms, but I'm going to have to use a couple, so bear with me. So, you know, many American companies, especially large employers, now have these employee wellness programs. Chances are you're involved in one or you know somebody who is. And the background of these programs is that they were facilitated by regulatory changes that occurred in the Patient Protection and Affordable Care Act of 2010, also known as Obamacare, or the ACA, Affordable Care Act. And the way that this happened was the ACA amended something called the Employee Retirement Income Security Act, or ERISA. And what that did was it allowed group health plans to adopt wellness program incentives that kind of vary a person's group health plan's premiums or cost sharing based on their health status. So it basically created programs that are called health contingent wellness programs. And they can do this, and they can deploy these programs in different ways. They can offer rewards for meeting a certain standard. They can offer rewards for employees who have like health problems, maybe obesity or something else, and reward them for doing what they would consider a healthy activity, like joining a gym. Then the Department of Labor issued some regs on the ACA in 2013, and they said basically that these programs, even though they're using health status to make determinations, that they would not be considered discriminatory under the Americans with Disabilities Act if they followed a set of standards. So some of the standards that health contingent plans had to follow were they had to limit the reward of the available reward, like a discount on a premium, to a certain percentage of the total cost of the health plan. They also provided they had to give their employers waivers for not participating, or also give them alternative ways to earn some of the rewards that were being offered. So those are a couple of the standards. The Department of Labor also said that wellness programs that don't use this kind of health status to determine the rewards or the penalties are called participatory wellness programs. Some people might quibble with whether something your employer offers is in fact participatory at all, but that's how these were designated. And these programs aren't required to meet any of the standards that apply to the health contingent wellness programs. So the rules say that other employment discrimination laws might apply, and they say that being in compliance with ERISA, the ACA regulations, the wellness program standards does not mean that they don't need to comply with other laws, like the ADA. And Debbie will dig into this more in a little bit. Excuse me. So for companies, adopting the programs has been a really interesting way for them to reduce health benefit spending. And as most people probably know, this is a huge burden on a lot of companies. So here they saw something that was being incentivized, something that was facilitated through regulation. And what they realized is using data analytics, they could identify employees with health risk factors. And the point of doing that is to mitigate those factors. So the model is providing employees with feedback, giving them goals, opportunities for behavioral modifications and other applications. And this is to reduce future health costs. And a lot of employee wellness programs, just from a data perspective, have lots of different data collection components, including something called a health risk assessment. And that's sort of a detailed form that you fill out that asks things like, do you smoke? Are you pregnant? Or do you have depression? Clearly things that are pretty sensitive, and you may not want to share with your employer. They also include things like biometric screenings, and a lot of programs have started using wearables like activity monitors to measure fitness, and also mobile apps to track sort of like what food you buy or what you eat. And these are all supposed to help help these behavioral modifications. The problem is that, first of all, many participating employees in these programs don't realize that, in fact, the programs are really meant to reduce costs for the employer, and that they're tracking employees with these high-risk profiles. It's not something that's really clear to employees, and it's problematic from that point of view. Also, the data from the apps and devices can be combined with public or private data And many of the device and app features actually depend on that. So, in other words, data from a supermarket to verify that you bought the food that you said you did. Data from gyms. I've heard of GPSs that can ping your phone when you go to the gym and then ping it half an hour later to make sure that you're still there. And so, this starts to combine data in a way that can create profiles that can actually adversely impact people in terms of credit, in terms of insurance rates. Lots of different ways can come into play. So the rules about this data, how can this data be disclosed, is actually really complicated. Not surprisingly, wellness programs can be either a part of a health plan or they can be separate from a health plan. And different rules apply depending on the structure, and I'll talk a little bit more about that in a minute. Another complication is that wellness data exists in different databases that are controlled by different companies. So they all have different privacy policies. Some have no privacy policy at all. So it's sort of the same data, maybe under different protections in different places, just to make it super complicated. In general, in the United States, our privacy regulations are based on sectors. So like healthcare or finance. So when data is disclosed, you get a copy, and the company disclosing it keeps a copy. And so if data kind of moves between these sectors, no rules basically can apply to copies of the data, depending on who has it. So for example, several companies could have data from a fitness tracker or app linked to a wellness program, and there's really very little that you can do about the disclosure of that data. One copy would be with the device or app, and who would sort of do what they will in terms of their privacy policy, and then another might be passed to the wellness vendor, who might actually then be subject to the HIPAA privacy rule if the wellness vendor is acting on behalf of a health plan. So, a lot of when it's in a health plan, the data is subject to the privacy rule of HIPAA, which actually is more of a disclosure rule. A lot of people talk about it as a privacy rule, but it's in fact more of a data disclosure rule, and it allows a lot of uses and disclosures for health-related purposes, and it doesn't require individual consent for that. And then that includes things like data analysis for health plans, outcomes evaluation, treatment guidelines, that kind of thing. But it does have some meaningful use and disclosure protections for individuals. So a key one for employees is that they have to authorize the use of HIPAA-covered data for employment-related decisions. So that's an important protection in the employee wellness program context. Employers comply with HIPAA requirements by hiring vendors to collect and analyze individual-level data, and then having the vendors deliver only aggregate or statistical results to them. So that's sort of one way in which they will get the data, but it's not identifiable to them. So that's how they're complying. Outside of HIPAA, wellness programs that don't meet a definition of medical care, which is the standard, can be offered actually either inside or outside a health plan. Some employers have programs that offer employees discounts on wearable fitness devices with points or rewards for taking a specific number of steps, as I mentioned before. Those aren't considered medical care, and they can be offered as a part of benefits that are unrelated to health, and thus HIPAA does not apply. So non-HIPAA data is protected only by the privacy policies of the companies, as I mentioned, or the employers that they serve. And wearables and other types of fitness-related devices and apps, there many, many times do not have policies, and when they do, they're typically documents that allow for broad uses and disclosures, operations, devices and services, research, marketing and promotion, that kind of thing. So there's a lot of troubling implications in terms of how data flows in and out of these employee wellness programs, and the privacy aspects are many. People can be discriminated based on their employer. May decide, well, if you have a risk factor, then really we don't want to promote you. We don't want to run the risk of paying more for you, or the fact that you may you may not be a good worker because we perceive that based on this information that we've gotten. Also, credit histories, this kind of information flows into profiles, as I mentioned, but they can be in different contexts. So, in other words, if you weren't very good with your activity tracker one week, but were the next week, maybe that context is not following your data. So it can be taken out of context very easily and impact things like your credit score. A lot of banks look at credit score, will look at this kind of information, will also look at social information and combine it to create a picture of who they think you are, which may not in fact be real or true. And this data is not something that is easily accessed by individuals. In fact, most people don't have any idea that the profiles exist. So I hope that kind of gives an overview. I tried to avoid as many acronyms as possible, but now hopefully Debbie can kind of go into, what this means in terms of the EEOC, the Equal Employment Opportunities Council, and talking about kind of their role with regard to employee wellness programs and sort of their evolving position on discrimination.
Thanks, Michelle. And thanks again to the Center for Democracy and Technology and also to Health Data Explorations for inviting AARP to participate today. For those of you who are a long way from 50, AARP is a nonprofit, nonpartisan organization representing people age 50 and older. As Michelle indicated, what I'd like to focus on today is the use of health data by employers and their contractors and the serious civil rights concerns raised by these programs. Wellness programs in and of themselves, things like reimbursing, employees' gym memberships and running Weight Watchers classes at work and, encouraging people to exercise more or having healthy choices to eat at lunch or whatever. All of those things are just fine as activities. And if you ask employees, they'll say they really like the idea of their employer offering wellness programs and helping them get healthier. But these programs often use methods that go well beyond voluntary offerings. More and more, they are using these health risk assessments that Michelle mentioned, the questionnaires that ask employees about their health status and their health-related behaviors, or they even require you to take certain kinds of exams, which they tend to call biometric screenings, that, for example, measure your blood glucose level or your body mass index or your blood pressure, that sort of thing. And Fitbits and other wearables would seem to fit right in there. The Americans with Disabilities Act, which prohibits discrimination in the workplace on the basis of disability, actually explicitly prohibits employers from making disability-related inquiries of their employees or requiring them to take medical examinations, unless either doing so is necessary to do the job or they're part of a voluntary wellness program. So there is a wellness program exception in the ADA, but it has to be a voluntary wellness program. And there's a good reason why those behaviors, making inquiries and asking your employees to take medical exams, there's lots of good reasons for why employers were prohibited from doing that. But the main reason is that employers really cannot be trusted not to discriminate when they have that kind of information about an employee's disability or medical condition. And so it's actually considered an act of discrimination to even ask for that information. In the past, the EEOC, Michelle asked me to talk about the EEOC's role. In the past, the EEOC's role has been to ensure that wellness programs don't cross the line into violating employees' civil rights, and that provision about making inquiries or requiring exams is truly voluntary. And they've long taken the view in their guidance that a voluntary wellness program is one where the employer can neither require you to participate nor penalize you for not participating. So then, as Michelle notes, along comes the Affordable Care Act, which actually expanded some previous legal provisions allowing wellness programs. But the Affordable Care Act really sort of put those provisions on steroids. And the ACA said that wellness programs are something that employers can offer if they follow certain guidelines. They can offer these programs and they won't be considered health discrimination under the ACA, because as we all know, part of the whole reason for the ACA was to stop health insurance companies from discriminating against people with health conditions. So what the law says is it's not discrimination on the basis of a health condition to offer these wellness programs with various rewards and penalties under certain circumstances. But the regulations under the ACA also say that wellness programs must also abide by the civil rights laws, that obeying the regulations under the ACA are, that's necessary to comply with the ACA. But you haven't complied with the civil rights laws by virtue of that. You still have to comply with the civil rights laws. So the ADA's provision saying you can't make medical inquiries or medical exams required of your employees still applies to wellness programs. As you can imagine, the business community was not pleased with that because they wanted pretty much unbridled authority to do whatever they wanted with these wellness programs. And so the EEOC came under strong pressure to change the regulations about what constituted voluntary under the law, and instead to allow them to impose penalties. Here's the essence of what the EEOC did. The EEOC did not go as far as the business community wanted. They didn't say you get a get out of jail free card if you abide by the ACA. But what they did do was redefine voluntary for the first time to allow employers to impose significant penalties on employees who refuse to provide medical information to their employers. Here's the essence of what they proposed this past April. You can't require an employee to participate, but you may impose rewards and penalties of up to 30% of the total employer-employee cost for health insurance. And this is for employee-only insurance. So, for example, if in employee-only insurance, it's just you, the employee, not your family. If your total premium is $1,000 a year and the employer pays, say, $800 of it and you pay $200 of it, your employer can impose a 30% penalty on the $1,000. So that's a $333 a month penalty.
That's
on
a lot.
top. Pardon?
I'm just commenting that that's a lot.
It's a lot. It's more than your premium.
Yeah.
They can impose that on top of the $200 you're already paying as your share of the health insurance premium if you refuse to take a health risk assessment or a blood test. That's nearly $4,000 a year in penalties on top of the cost of your health insurance. And we think, and I'm guessing, if you were in this position, you would think that requiring an employee to pay hundreds or even thousands of dollars more for their health insurance, premiums, deductibles, things like that, is just obviously coercive. Whether that surcharge is called a penalty or a failure to earn a reward, you're paying out of pocket a whole lot more money because you don't want to provide medical information that the Americans with Disabilities Act says is protected, that you don't want to provide that to your employer. So that was one provision of the EEOC's proposal. Another provision was they said that you have to give the employee a written notice describing what kind of medical information they're seeking and how it's going to be used and what restrictions there may be on disclosure and who the information can be shared with and how they're going to protect the information from being improperly disclosed. But the bottom line here is that while that is perhaps important information, it doesn't eliminate the violation in the first place, which is this is a notice that you are about to be coerced into having your privacy and possibly your civil rights violated. The final piece of the EEOC's proposal related to confidentiality. As Michelle indicated, HIPAA applies some privacy protections to some personal health information collected by some actors. but HIPAA, by its terms, doesn't apply to employers directly. The EEOC, sort of recognizing that, attempted to supplement privacy protections by saying that if and when employers get this information that was gathered in the wellness program, it has to only be in aggregate form. It can't be in a form where you can individually identify the employee and their health conditions. But they attached a huge loophole to that. They said, except as necessary to administer the plan, whatever that means. Those of us who are concerned about employers getting this information argued that there need to be much better protections, not only in terms of preventing the employer from getting this information, but really we have no idea what's happening to this information. It's pretty much the Wild West out there. The Kaiser Family Foundation uncovered instances in which wellness program vendors, the people who are hired by employers oftentimes to offer, to provide these programs, they'll have like fine print waivers on their website stating that just by using the website, you have consented to allow them to use the information, share it with anybody, do whatever they want with it. And with the advent of sort of big data, not only might this information, say be sold to a treadmill manufacturer to advertise to you that you should buy a treadmill, but it also can be, sold to big data vendors who compile all this information and match it up with, whatever else is out there about you. And there are these huge financial incentives for the vendor to sell that information. So rather than, promoting employee health, which was supposedly the reason for these programs, what ends up happening is you've got a captive audience of coerced employees who have to provide this information to some third-party vendor who's then, possibly providing it to your employer and selling it on the open market for a profit. And the EEOC's proposals never really addressed that kind of breach and that kind of misuse of the data. So this is something that AARP and many other civil rights groups are very concerned about, and hope that we can have a further discussion about the civil rights and other implications.
Great. Thank you, Debbie. That was a really fascinating discussion. Thank you for that. Emily, love to hear your thoughts on the wellness programs and sort of how the data components can have disparate impacts on different communities.
Great, yeah. So I'm going to expand a little bit on some of what Michelle and Debbie already talked about. And I'm going to talk about a number of federal civil rights laws, and again, I will try to explain acronyms, but I'm necessarily going to use a few of them. Our big federal civil rights laws that protect against discrimination in a number of areas prohibit discrimination in employment, including in what's called the terms and conditions of employment, and so that covers employee wellness programs in most instances. Let me talk about disability first. So the Americans with Disabilities Act, which folks already mentioned, prohibits discrimination in the workplace, among other places, against people with disabilities. And disabilities is a pretty broad category. It covers, folks in wheelchairs, which is what might come to mind first for you, but it's also covering folks with diabetes, people with mental illness, people with cancer in some cases. It's a very broad category, and in fact, it was broadened in 2008. So there are a number of ways in which wellness programs can result in discrimination against folks with disabilities. One that I think is probably maybe not as common, but might be the first thing that comes to mind, is the idea of an employer or a health plan sort of targeting a particular disability that's very expensive to cover and trying to get people out of coverage by charging them huge penalties. I actually think that's maybe not happening as often as some of the other kinds of discrimination that are a little bit more hidden. So, there are a lot of folks with disabilities who may not be able to achieve health targets that are part of certain kinds of wellness programs, the health contingent wellness programs that were mentioned earlier. So, for example, if there's a blood sugar target under a health contingent wellness program, someone with diabetes, literally just by the nature of their disability, may not be able to meet that target. Similarly, if there's a blood pressure target, someone with hypertension may not be able to reach that target. There's an availability of alternative standards under these rules for wellness programs, but it's not quite clear how those are going to play out, and they still involve the disclosure of personal information because, of course, in order to qualify for an alternative standard, you're going to have to tell your employer or the wellness program why you need that alternative standard. In some cases, that might even involve medical documents or a conversation with your physician. So that gets to the second area, which has already been touched on, but the idea that discrimination, particularly under the Americans with Disabilities Act, includes inquiries into disability-related information and medical exams. So the ADA, one of the reasons the ADA was passed was there was a history of employers particularly, but in other contexts as well, employers asking people for information that led to the disclosure of a disability and then denying those people employment or firing them. And that was lawful before the ADA. Your employer could ask you, do you have diabetes? Well, we don't want to employ somebody with diabetes, so we're going to fire you. Or do you have a mental illness? We don't want to hire somebody with a mental illness, so we're not going to hire you. And so wellness programs, really conflict with this idea in the ADA that employee disability-related information is private. Employees should get to choose when and if they disclose a disability to an employer, how they disclose it, who they talk to about it, what kind of information they share should be entirely up to the employee and should not be required by some aspect of their employment, including a wellness program. The ADA also requires that when disability-related information is disclosed, that it be kept confidential and safeguarded for the same reasons that we want to make sure that people with disabilities have ownership over their private information, get to choose when they're disclosing that information, and then it's not just out there in the world for anyone to take a look at. Understandably, folks with certain kinds of disabilities where there's particular stigma attached, although, I think this is true for all disabilities, that a lot of folks, it's nobody's business and they want to kind of keep it to themselves. But for particular disabilities where there's real stigma, it's so important that people have ownership over that information and choose when and whether to share it. Mental illness is a good example. That's what I focus on. Plenty of people with a mental illness would prefer not to discuss that with their employer, with the HR person, with the wellness program vendor. Just as an example, a veteran with PTSD may really prefer not to have to fill out a form, a health risk assessment that requires her to disclose that information, may really prefer to not tell the employer or the wellness program vendor why it is that she's undergoing a certain kind of treatment and can't participate in the nutrition counseling or the other kinds of counseling that might be available or required under a wellness program. So there's it's really important that employees get to choose when and whether to disclose a disability. We haven't mentioned yet, but the Genetic Information Non-Discrimination Act is another federal civil rights law that protects folks from having to disclose genetic information, and these wellness programs can really butt up against those protections as well. particularly where family medical history is being requested, where there's a genetic predisposition to a certain impairment. It's, you know, the wellness programs, really, it's not clear yet, and the EEOC hasn't spoken yet on how wellness programs can exist in the same realm as GINA, the Genetic Information Non-Discrimination Act, which we had thought until the EEOC's recent rulemaking that Debbie described had similar protections to the ADA. Now that's somewhat in question. And finally, the last way that wellness programs can lead to discrimination is simply that when employers have information about disability, that information can be used to discriminate against the employee. So it may not be that the employer writ large has some nefarious plan to get rid of employees with mental illness, but a particular supervisor who learns about mental illness due to information that has to be disclosed through a wellness program, you know, a human resources person, you know, those decision makers can impact an employee's employment status. And discrimination, you know, in my experience as an employment discrimination litigator, discrimination often happens on that individual employee to supervisor basis. And so, again, this goes back to the importance of privacy. Keeping employee data, health data, private and confidential is so important, and I would argue employers shouldn't be getting it at all, you know, and that employees should be in complete control of when and how they share that information. Okay, so that's disability. Let me talk just quickly about a few other categories of folks who are protected by our federal civil rights non-discrimination laws. Women are protected as well, and under these laws there is a concept called disparate impact, which is a legal theory that essentially says that neutral policies that have a disparate impact, an adverse impact on a protected category can still be discriminatory, even if there was no intent to discriminate. That theory is available under the ADA as well, although under the ADA, as I just described, there are some more direct ways in which discrimination can happen. So under Title VII of the Civil Rights Act, which protects against discrimination on the basis of gender and race and a number of other categories, women are protected from discrimination. But an employment-based wellness program that, for example, asks women to disclose whether they're pregnant or breastfeeding or intend to become pregnant, or that requires them to engage in certain activities when they have childcare responsibilities, or requires them to meet certain health targets when they are pregnant and cannot meet those health targets, such as a body mass index target or a certain level of exercise or something like that, could have a disparate impact on women and therefore could be a violation of Title VII. Similarly, under Title VII's race discrimination protections, again, a disparate impact theory. There are certain kinds of impairments that are more likely to strike African Americans and other minority groups. And so wellness programs that targeted those particular kinds of impairments, such as hypertension or other kinds of impairments, could also have a disparate impact based on race. A similar theory applies under the Age Discrimination in Employment Act, and I'll let Debbie speak briefly about that since that's obviously in her wheelhouse.
Just a quick note on that. Thanks so much, Emily. Older workers have a huge stake in this issue because workers with disabilities are actually more likely to be older. About 2/3 of all workers in the labor force who have disabilities are 45 and older. And in addition, older workers are more likely to have some of the very types of conditions and disabilities that are less visible and therefore at risk of disclosure by these medical inquiries and exams. And, you know, the EEOC actually recognized that in its guidance. They said that you know, many employers ask for this kind of information, which is, you know, historically been used to exclude and discriminate against people with disabilities, particularly people with non-visible disabilities, such as diabetes, epilepsy, heart disease, cancer, and mental illness, despite their ability to perform the job. And as you can imagine, we reminded the EEOC of that when we filed our comments. So we think older workers have a huge stake in this issue, and along with all of the other groups of workers who potentially would have concerns about this direction of policy.
Thanks, Debbie. So just quickly, a couple of other categories of folks, and these are people who are not directly protected by federal law, unfortunately. First, members of the LGBTQ community. Obviously, privacy is an important issue for that community, but also there may be certain ways in which wellness programs may have a particular impact. For example, transgender folks and other folks in that community who may be particularly impacted by certain kinds of wellness programs that require disclosure of personal information, or even wellness programs that have health targets associated with them. And then lastly, folks who are low income. You know, low wage workers are going to be far less likely to be able to pay extra premiums, so they may feel more coerced than other groups into filling out health risk assessments or otherwise participating in wellness programs, and yet at the same time they may have less ability to actually participate. You know, for example, if you're working 2 or even 3 jobs, you're not going to have time to go to the required gym classes or other kinds of requirements that a wellness program might impose on you. You know, also folks may have childcare and other family care responsibilities that make it difficult for them to participate in these sort of extracurricular activities that may be required under a wellness program. So I think, you know, it's really, really important to remember the impacts on vulnerable communities, particularly given the many, many years we spent struggling to gain rights for these folks, and now we're talking about, you know, taking away some of those protections.
Thank you. That's a great discussion. Thanks a lot. Sorry, go ahead, Cindy.
Oh, sorry, Michelle.
You go ahead.
No, I was just going to thank you all. That was just a fascinating rundown of some of these issues. So we have, so it's 11:12 right now. We have about 15 to 18 more minutes left, and we have a couple of questions that have actually come over the Google Hangouts. And so the first one, and I have some questions myself. This is just a fascinating area. So the first question comes from Camille Nebaker. She says, "Excellent panel, thank you. How can we increase public awareness of the potential risks for discrimination?" So that's her question, and I think it actually kind of dovetails with the question I had, which is, you know, so in a research setting, we think a lot about informed consent for participation. And so when I was listening to all 3 of you talk, I was sort of wondering, you know, where sort of the informed consent happens, kind of in the different steps of a wellness program, or in, like you said, the employment terms and conditions. You know, is there kind of one stop for that, or are people expected to sort through, you know, a lot of legalese at different steps? And what would be your suggestions in this regard?
I guess I'll just say off the bat that I love the increased public awareness question. I feel like I almost never get that question, and it's at the heart of everything that we do and care about, is helping, you know, people to have a chance to know all of this. You know, it's not apparent, and one of the issues that we have a lot of times is the lack of just understanding, of the lack of transparency on the behalf of employers, also the devices, the third-party vendors. You know, it's complicated for us, and it's complicated for people who don't do this for a living. So, you know, what I would say is ask questions. You know, one of the best things that you can do is if somebody you know is enrolling or your employer is considering it or it has deployed an employee wellness program, that you make the effort to be an advocate for privacy if possible. So ask your employer where is this data going? Is this covered by HIPAA? Is this inside of HIPAA or outside of HIPAA? What will you see? What is the data going to be de-identified or aggregated in some way? You know, what kind of vendors are you using and what are their policies? Not only does this kind of, allow you to know the answers to the questions, but it also brings them up and brings them to an employer's attention. And I thought Emily made a good point when she said that it's not necessarily nefarious on the part of a lot of employers. They see an opportunity to reduce spending, and so they want to do it. But these problems are not always apparent even to them. So it's worth bringing up to your employer. It's worth talking about just to people you know. It's worth making notes about it on a blog or on Twitter and getting it out into the mainstream so that people are much more aware that this is going on.
Good.
I think that's right, and I'll just add that there has been some increased media attention to this issue over the last 6 or so months, I'd say. The Huffington Post has run a number of great articles. CNN recently ran one. So I think there is increased awareness. I think one of the things as advocates that we've really been trying to do is to find personal stories about impacts. And I didn't mention this during my part, but one of the more compelling ones that I've heard recently are impacts on folks who have eating disorders. Many wellness programs focus on weight management, and of course, folks with eating disorders struggle with that every day, and most of them are receiving treatment, and it's very careful, well thought out treatment with a medical professional. And then they're faced with a wellness program that's telling them, well, you just have to drop 10 pounds. Right. And it's not that easy, when you're struggling with an eating disorder. And so I think the more personal stories that we can gather as advocates, we're always happy to hear from folks. If you have a personal story, the more we can gather those and pass those along to the media and get the word out, the better. But I agree with Michelle that change starts at home. Change starts with your employer. So if you're an employee of an employer who's using wellness program vendors and you have an opportunity to push back a bit and really get the employer to think carefully about how your data is being used, what kind of a wellness program it is, and the impacts that it can have on you and your colleagues, please do so.
And I just want to add a point that I'm not sure we made, which is that there's a lot of uncertainty about the actual positive effects of these programs. In fact, there have been some studies that have come out recently that have said not only do they not actually reduce costs for employers, but they can actually harm people. So in other words, they're in the vein of do no harm, health, wellness, and yet they've shown that, for example, with tobacco cessation, people are 3 times as likely to start smoking again after they go through this kind of program. They're more likely to gain weight after they go through sort of one of these employee wellness weight loss programs. So, even more than privacy, although that's crucial, there's also the sense that these programs are not doing what they were designed to do.
Yeah, so we have a couple more questions, and this is great because I was thinking about impacts as well, sort of both positive and negative. So this question comes from Matt Beats. I don't know if there's evidence, but I would assume that workplace wellness programs do have a health impact. Is there a way to maintain the public health benefits while protecting privacy? And he asks, more regulation, taking them out of employers' hands. So I guess the question is kind of multifaceted, and it's related to a question I had too, which is, we haven't talked about many positive aspects of wellness programs, and I'm curious if any of the panelists see any benefits.
I just want to say one thing. I'm actually a big proponent of health data. I think there are a lot of amazing potential to help people and society, and none of this is about taking that away. This is about, there are benefits and positive uses, and then there are abuses. And I think this veers toward the side of abuse. And as advocates, it's our job to kind of be the thorn and say, hey, everything that's great, but You know, my family says my job is to make them paranoid constantly. So it's not that, you know, people are out to get you and health data is bad. It's quite the opposite. And actually, you know, privacy is a strong empowerer, or, you know, it actually is a driver for people to adopt these kinds of programs. So if they feel like, you know, there is informed consent, as you mentioned, Cinnamon, that there is transparency, that all of these things are not just being forced upon them by advocates like us, but are actually right from the start, right there. What about also having some kind of metrics for employees to figure out if it's actually helping them? You know, for employers to really figure out, is this harming people, actively harming people, or helping them? You know, I think sometimes with the third-party vendors, it looks like an easy out for employees, but what you lose in sort of goodwill from your employees, you know, feeling like you're being invasive, or feeling like you're actually harming their attempts to quit smoking or to lose weight, that it has to be factored into the equation. And privacy, I think, you know, the different ways that it can come into play are I mentioned. I think informed consent is tricky. I think it's a part of some of the regulations. You know, I think Debbie went over some of those, that you have to let people know a little bit about what's going on and where the data is going, and that's crucial. And we also, you know, commended the EEOC for making that a part of it. But it's sort of like, you know, what she said, which is, here, we're giving you notice that we're going to violate your privacy and civil rights. And, you know, when you're in an employment situation, the coercion is hard to deny. I mean, it's really difficult for people to say no, even if they want to. So I think it's got to be more than just consent. I think it also has to be a limiting of data collection. So, you know, really minimization in terms of what they actually need. For example, do you really need the data to be identified at any time? Is that something that's necessary? No, right? I don't. Maybe I'm missing something, and I'd be happy for people watching or anyone to give examples of why you would. But from my perspective, you probably wouldn't. And if it's a small organization, making sure that even if it is de-identified, that there are ways to, you know, kind of put firewalls up and make sure that there's explicit rules in place to encrypt the data, to make sure that it doesn't go to certain places. And also asking employers to require vendors to have disclosure agreements that actually limit the data versus disclosure agreements that say, well, we're going to do whatever we want with it. Just because they can doesn't mean that they can.
This is Debbie. I would add to that employers are in a position here to help deal with at least one of the problems, which is the conduct of third-party vendors and what happens to the data in that program. Employers are fully able to make it a condition of their contracts that information cannot be shared or resold to anyone, and that the information only be used for purposes of either helping the employee get healthier, or just reporting on very aggregate statistical outcomes to the employer so that they know whether the program is worth offering. But it's pretty easy to draw a reasonable line here, which is that employers can offer these programs. They could even offer some of the what we would consider to be sort of the more invasive types of programs, but that they don't make them required, and that they don't coerce people with penalties that make them feel like they have to do this in order to, be able to afford their health insurance.
Yeah, that's a great point. So I think we have another question. I just want to make sure I get it out there. I think we may have answered parts of it, but I'll just read it anyway. This is coming from Olivier Murat, I think. This isn't really about ethics and privacy, but I'm just curious, are these wellness programs leading to measurable health improvements for employees, or are they just meant to collect health information about employees? I think you kind of touched on aspects of this question, but I'll if there's any parts you want to add, I'll put it out there.
I think that the only thing I could add is maybe a little bit of perspective, which is that a lot of the sort of push behind employee wellness programs happened a number of years ago. There were a lot of people in the White House, and the Clinton White House, and Bush and Obama that really believed in these programs. There was a lot of evidence that there was a potential that prevention was the key, and here's a win-win. Employers can reduce their costs and we can get people healthier. So there's a lot of good intention, I think, behind these programs being incentivized. I think what's happened though is since then the explosion of personal health data in lots of different places, lots of different devices, lots of different apps that don't have any kind of real regulation that cover how the data flows, etc. I think these were very unanticipated, and so I think in some ways it's just a matter of kind of catching up the programs to the data world that we live in today and making sure that those protections are there. But that said, yeah, there have been indications for a while from certain studies and surveys that maybe these programs aren't actually doing anything. Maybe these aren't actually not only offering a reduction in cost, but actually creating cost. Is one study came out the other day that said was sort of implying that maybe it increased emergency room visits and other things that are really expensive. And also, the idea that it's actually creating harm is a huge problem. That's not something that we should be incentivizing, as a government, and it's not something that employers should be deploying. If there are contrary studies, I don't really know about them.
Mm-hmm. Okay.
I just wanted to add quickly. Oh, I just wanted to add
really quick that we should Michelle, we should get those references from you and make sure we post them on the site.
No problem. No problem.
Just quickly on that along those same lines, in terms of cost savings for employers, the studies show that it's really about cost shifting. So it's shifting costs to employees, and as we discussed, often it's going to be shifting costs to employees who can least afford it. So not only is there now data showing that in terms of health improvement, that may not be happening, but the cost savings are really more about shifting costs to employees, and that's a real concern as well.
I think there's room in this space for, I know a lot of third-party vendors may take exception to some of what we said, and they say, we are very privacy protected, we do care about this, and no doubt they do, but it's not going far enough. It's not going far enough to limit data, to make sure that there's real transparency, et cetera. So I think it would be great to see a company in this space kind of stand up for privacy and civil rights, and make a statement by baking that all into their design of their product.
Agreed.
Great. So we are, it's 11:27, we're 3 minutes before 11:30. I just want to thank all three of you for a terrific discussion. I think, Michelle, your comments just now on the need for transparency is a great positive way to end the discussion. I think everybody can agree on the importance of transparency and participant and employee engaged health and programs going forward. So thank you all very much. Alex, do you have any other comments?
Stay tuned for the next webinar.
Stay tuned for the next webinar. We anticipate that it's going to be on November 13th. And stay tuned for advertisements for that program coming up. Thank you all.
Great, thank you.
Thank you.